My name is Shaun Johnson, I'm a floating head and torso, and today I will be giving a commentary on Atlus's Trauma Center Second Opinion for the Nintendo Wii. Additionally, I will be explaining some medical discrepancies that this game presents. To briefly describe the controls in this game, the nunchuck is used to select which tool you want to use, whereas the Wiimote is used to activate this tool. Without further ado, let us begin a labarotomic cystectomy. Now, this procedure must take place on the surface of the pancreas. Found there are some benign cysts that must be removed in order to prevent them from becoming malignant. So initially, some antibiotic gel solution must be applied to the surface of the abdomen for sterilization purposes. After that is done, a scalpel can be used to make an incision that will expose the pancreas. Once the pancreas is visible, as it turns out, it is inflamed. Therefore, some anti-inflammatory medication must be applied to reduce the swelling. Once the swelling is reduced, then the ultrasound should be used in order to identify the exact location of the cyst. Once one of the cysts has been found, an incision should be made with the scalpel on the surface of the pancreas in order to fully expose the cyst. Once exposed, the cyst should be drained of its cytoplasm. Once this is completed, then the cyst should be removed using the scalpel. Once the scalpel can remove and isolate the area, then it should be removed with a forceps and then properly disposed of. Once this is completed, then the synthetic membrane can be applied to the surface of the pancreas. Now, since it's made of protein, there is no chance of tissue rejection. Once this is completed, then the exact same procedure should be done for the other two cysts. Now that this is completed, the initial incision must be stitched back up. So, using some sutures, this can be easily fixed. Once the incision is properly sealed, some antibiotic solution should be applied back to the surface, so this can be sterilized once more. And after this is completed, then a bandage can be used in order to seal up the area and help healing. Once this is completed, our operation is a success. Despite the fact that this video game provides a simple, manageable depiction of a complicated procedure, there are quite a few medical errors throughout the game. This in mind, I will be able to only name a few of the more prominent faults. For instance, there was little bleeding or hemostasis shown in the game. To control the blood loss, heat or an argon beam plasma coagulator should be used to seal the blood vessels. And, unlike the game, the location of cysts or tumors are usually found beforehand using an MRI, a CT scan, or an ultrasound. A CT scan is exceptionally useful because it can also determine beforehand whether or not the cyst is cancerous. An ultrasound is also extremely useful because it can use an endoscope to take photos or even samples of the fluid in advance without having to perform any invasive surgeries. Additionally, a laparoscopy, an extremely small incision, is always preferred over a laparotomy, which is a large incision demonstrated in this game. It is much less invasive than the other. Also, cauteries are often used in place of scalpels to cut apart tissue. This allows the blood loss not to be as great. Finally, the pancreas is not easily visible as shown in the game. The stomach actually covers the pancreas and would have to be suspended away from the pancreas if this procedure was to be done. Disregarding the various flaws in this game, I do hope that you found this video useful in depicting a surgery from the perspective of a surgeon. Thank you very much for watching this video.